Are undocumented immigrants on Medicaid? It's a question that's been weaponized politically, but rarely answered honestly. The short answer? No. Undocumented immigrants are not eligible for full Medicaid benefits under federal law. But misinformation travels faster than truth, and when political figures choose distortion over compassion, we lose more than clarity, we lose lives. What the law actually allows. Federal policy excludes undocumented immigrants from standard Medicaid access. They are only eligible for Emergency Medicaid, and only if they meet income thresholds their condition qualifies as an emergency, that is labor and delivery, trauma, which includes life-death situations. Even then, coverage is limited, not preventive, not primary care, not ongoing treatment. The Congressional Budget Office, CBO, estimated $27 billion over 6 years for emergency services, not Medicaid benefits. That money went towards saving lives in emergency rooms, not covering healthcare costs the way citizens receive. FQHCs, the unsung safety net. I've worked inside a federally qualified health center, FQHC, in the accounting department. I saw firsthand care provided to everyone, regardless of status, funding streams that had nothing to do with Medicaid patient data collected not for entitlement access, but to help programs like HRSA track community need. FQHCs operate with grants, sliding fee scales, and public service mandates. Yes, some of the services are paid for directly by the immigrant. FQHCs aren't delivering Medicaid, they're delivering mercy. What political leaders know but don't say. Republican leaders pushing legislation to restrict emergency care for undocumented people know these distinctions, which means the question isn't, are they on Medicaid? It's, do we care if they die? That's the spiritual heart of this debate, scripture and moral clarity. The Bible doesn't split hairs when it comes to the vulnerable. Do not mistreat or oppress a foreigner, for you were foreigners in Egypt. Exodus 22:21. I was a stranger and you did not invite me in. Matthew 2:5-43. Is this not the fast I choose? To share your bread with the hungry? Isaiah 58:6-7. If emergency Medicaid is meant to save lives, and leaders want to block it, then they're choosing death over dignity and doing it under the guise of fiscal responsibility. That's not stewardship. That's idolatry dressed in nationalism.